Rounds. So welcome everyone to our journal club session today. We have a really great paper to discuss. Dr. Will Whitehouse from Purdue will be leading the discussion on persistent incontinence in Goldens following ectopic ureter ablation. This article came out pretty recently in JAVMA. And like always, we try to encourage this to be an interactive presentation and discussion rather than a lecture. So please jump onto the chat, unmute your microphone, and share some comments and join the discussion as you would like. And we look forward to it. So I'll go ahead and mute myself, but go ahead, Will, you can go and kick it off.
All right, great. Thank you, Dr. Foster. I'll echo kind of what he said. Please feel free to kind of interrupt and provide any input kind of that you might have kind of throughout this. This is a kind of relatively straightforward kind of paper, so I think that we can get through kind of the material kind of pretty quickly. Again, my name's Will Whitehouse. I'm, as you can see, an internist at Purdue, but also a nephrology urology kind of resident here. And the main reason why I picked this paper was primarily to mix things up and to do a urology focus for one of these, to mix things up a little bit. So the outline for today, I'm pretty sure everyone's familiar with kind of ectopic ureters. We'll go through just a few selected things kind of in the background kind of about them, and then go through this study's primary objectives and hypotheses, kind of their study design, results, touch on a few points kind of in the discussion, go through limitations in further direction, and then kind of wrap it all up at the very end. So this figure is from the new ACVIM consensus on urinary incontinence that came out this year, so kind of hot off the press, and how it is primarily divided kind of is into kind of being either a storage disorder or a voiding disorder, kind of with storage disorders being more common, and USMI and ectopic ureters kind of being the primarily kind of etiologies in that category. This is also kind of from the consensus guidelines as well. So there are different breeds that have been found to be either predisposed or overrepresented, kind of both for having urethral sphincter mechanism incompetence, kind of, or ectopic ureters. And kind of with today's kind of study, golden retrievers kind of are obviously the focus and have been found to be overrepresented in a variety of kind of different studies, with these being kind of some of them. So in some of these papers, golden retrievers kind of encompassed up to a third of their kind of study population. The one that actually had a kind of control group kind of looking at patients and their specific breeds that came in with ectopic ureters compared to those without, in the rest of the hospital kind of population, found that Goldens had a, I think, odds ratio of 9.3 with regards to, again, kind of being predisposed to ectopic ureters. There's a fair amount kind of that is known and kind of published about ectopic ureters in dogs. So a quick kind of PubMed search kind of yielded kind of over 100 kind of articles, but not much is really known about predisposing or risk factors that contribute to continued urinary incontinence kind of after ectopic ureters are corrected. There are a few papers that specifically kind of tried to look at this. Most of them are dogs who had their ectopic ureters corrected via different surgical techniques. And all of these papers kind of suffer from the same things kind of with regards to kind of the retrospective natures of their study and kind of really low sample sizes. So a lot of these parameters kind of that have been looked at are very likely kind of underpowered. This one, I think from Bristol out of 1991, had 20 dogs, and they found the age, kind of whether the ectopic ureter was unilateral, bilateral, kind of whether or not urine was positive for bacterial growth kind of at the time of procedure were all not associated kind of with post-op kind of urinary incontinence. This study had kind of more patients. Of the 175 total cases, 156 kind of were females. However, not all of these patients actually had their ectopic ureters corrected. And they only looked at a couple of potential risk factors besides the surgical procedures kind of themselves, but ultimately found that urethral length and urinary bladder position, i.e. kind of pelvic bladders, did not seem to be associated with post-op urinary incontinence as well. This one is a little bit more recent, I think 2010 or 2011 in Jaha. These dogs were seen at Virginia, Maryland. And similar to kind of the other papers, these authors found that whether ectopic ureters were unilateral or bilateral, kind of intramural or extramural, whether or not these patients had hydroureter present or had urinary tract infections kind of prior to the procedure, those parameters were not associated kind of with post-op urinary incontinence kind of in their group. And kind of this one is, I think, the most recent, 2017 in Vet Surge. They had 47 dogs in their study cohort, 36 of them kind of being females, and kind of going along with the same theme, breed, kind of whether the ectopic ureter was unilateral, bilateral, kind of intramural or extramural, or if these patients had concurrent congenital urogenital abnormalities where they put hydronephrosis and hydroureter kind of into that category, or presence of having a pelvic bladder were not predictive of kind of outcome of post-op incontinence as well. So that brings us to kind of today's paper, again titled Persistent Urinary Incontinence in Female Golden Retrievers Following Laser Ablation of Intramural Ectopic Ureters May be Associated with the Presence of Historical kind of Urinary Tract Infection. And the stated kind of objectives of the study, their primary aim was to identify prognostic factors that affect kind of both short and long-term continence scores in female golden retrievers undergoing cystoscopic guided laser ablation of their ectopic ureters. And their secondary aim was generally to add to the literature on efficacy kind of this procedure kind of in this breed. And their hypotheses kind of were that both the lack of a defined urinary bladder neck and subjectively reduced kind of urinary bladder compliance would both be associated with lower likelihood of achieving urinary continence following kind of laser ablation. So this was a kind of retrospective case series out of Queen's Veterinary School Hospital from the University of Cambridge. I have never seen nor been there, so I hope I picked the correct building from my Google search of them. And for those who like to kind of PICO papers, I guess there's a couple of ways to potentially kind of look at this. One of the kind of downsides of retrospective case series is that they often kind of don't have a comparator kind of group, and kind of the intervention with them could either be a diagnostic test or procedure. I've also heard people say that the review of the medical records kind of is the intervention. But with descriptive studies, one could look at exposure of, say, different risk factors kind of as opposed to an actual intervention. So the population in this study kind of were 41 female golden retrievers kind of with ectopic ureters kind of treated by laser ablation. Their intervention or exposure kind of were selected kind of risk factors that are proposed to contribute to kind of poor outcomes, kind of i.e. continued urinary incontinence after the procedure. And the comparison is kind of those without those risk factors present. And their outcome kind of was urinary continence scores. And then time frame for enrollment, these cases were from July 2016 to July 2022. And then time frame for follow-up kind of were 1 month and then greater than 10 weeks kind of post-procedure. I thought it was a bit odd that their inclusion criteria was actually stated in the introduction, but they aimed for a homogeneous kind of population of female golden retrievers, kind of all being less than 24 kind of months of age. All of them had ectopic ureters diagnosed by a standard protocol, kind of which essentially consisted of trying to find them kind of on ultrasound, but they were all confirmed on cystoscopy. And then their laser ablation of their ectopic ureters were all performed by the same individual. Exclusion criteria were not specifically kind of stated, though one dog was excluded for having incomplete medical records.
One thing that I thought was odd is they don't specifically mention their methods for diagnosing intramural versus extramural ectopic ureters. And I'm presuming that all these dogs were intramural since they were ablated, but sometimes they're a little bit of both and they're intramural and they dive off. But I was a little surprised that they actually didn't make any confirmation that they are intramural as extramural in their methods.
Yeah, that's a good point, kind of, Dr. Foster. I mean, again, one can assume that they were all kind of intramural just because that is what's commonly seen, and they were all kind of laser ablated. And I know that some individuals kind of advocate for doing kind of contrast studies kind of during the procedures while others kind of don't, but that's a good point. It wasn't kind of stated overall. There is a recent kind of vet-rad and ultrasound kind of paper kind of looking at ultrasonography and sensitivity and specificity of it for identifying ectopic ureters in dogs. And sensitivity is reported to be, and specificity, both reported to be relatively kind of high. The reason kind of for the range is that they looked at kind of both patient as a whole for being able to diagnose ectopic ureter, as well as individual kind of ectopic ureter or ureter kind of within each dog kind of as well. But again, kind of all were confirmed via cystoscopy, which was performed by, again, the same individual. We know that is 100% kind of sensitive. And the procedure kind of seemed kind of relatively standardized kind of as well, kind of including all of them getting kind of peri-op as well as post-op kind of antimicrobials. The data that was extracted kind of from the medical records were kind of age, neuter status, body weight, whether or not they had historical urinary tract infections, which they didn't really break down how many of them actually did have cultures versus how many of them were just based off of urine sediment kind of examinations. But the bacteriuria on urine sediment found at the referral hospital or primary care veterinarian kind of was the, I guess, bare minimum for making that diagnosis of having kind of historical infections. We know that there is a fairly high correlation kind of with having kind of bacteriuria on urine sediment and having a positive culture, but that could be dependent on experience of the individual kind of performing the sediment examination. And we also know that sometimes debris kind of is overcalled and mistaken kind of for bacterial organisms as well. Current medications were also kind of documented. Again, kind of these infections were kind of based on at least a UA kind of from the primary care veterinarian. All dogs kind of were reported to have a normal serum creatinine and BUN, and that was based on each individual lab's kind of reference range. And because of that, variation and heterogeneity kind of not looked at from a data analysis standpoint. And then ultrasound, they determine kind of both maximal ureteral and renal pelvis kind of measurements from that imaging modality. Their grading was described kind of here. So for grading of their urinary incontinence, 0 was a dog that was completely continent. 1, there was a dog that, or dogs that have occasional dripping of urine. And I don't know if anyone else kind of has a better way to try to distinguish between occasional and intermittent, because they seem fairly similar to me. But more severe than occasional was intermittent dripping of urine with occasional pulling of urine. And then a grade of 3 was continuous dripping of urine with frequent pulling of urine. They also kind of graded persistent vestibulovaginal septal remnants, kind of if they were present, and they kind of didn't quite use kind of the same terminology as kind of what's been described kind of in the Burdick paper in JAVMA, but they kind of go along kind of the same path. So a grade of 0 here was a vestibulovaginal septal remnant was not present. 1 was a thin band of tissue that was able to be easily broken kind of without the use of a laser. So potentially a persistent paramesonephric remnant. 2 was a moderate band requiring kind of laser to transept. And 3 was a thick plus or minus kind of wide band that prevented access of the scope kind of getting into the vagina and partially dividing it kind of longitudinally. So both of those could potentially have been vaginal septum. It didn't seem like they had any dual vaginas since they described just partial division. Presence of a urinary bladder neck and urinary bladder compliance were also subjectively assessed. So to me, it seems like these are things that are probably routinely evaluated kind of at this institution with all of these procedures, but they're obviously kind of subjective in nature. And I wish they would have described kind of their assessment of urinary bladder compliance kind of a little bit more, other than kind of the perceived amount of volume it took to fill the urinary bladder. They also scored or graded kind of openings of the ureters, where 0 is they were present in the trigone, and say that they are non-ectopic. And so I'm assuming that they were not kind of intravesicular ectopic. One was they were right at the bladder neck. Two was they opened up in the proximal urethra. Kind of three was mid-urethra. Four was distal urethra or vestibule. And then they also kind of routinely performed urine cultures on these patients, either through a sample obtained via cystocentesis prior to the procedure or with urine collected through the scope prior to peri-op antimicrobial administration. For follow-up, they reassessed kind of urinary continence, kind of being the scoring system that was just described, as well as documenting kind of what medications these patients were on, including kind of antimicrobials. What I liked is that it seems like following up with these patients, 1 month post-procedure was routine at this institution, kind of in general, but also the owners were contacted kind of at the time the study was performed by the principal investigator. And as everyone probably experiences kind of at a referral hospital where patients follow up with their primary care veterinarian or lost to follow-up. Long-term follow-up with these patients was variable, but minimum kind of was at least 10 weeks post-procedure. However, as implied, kind of data collection kind of for long-term follow-up was not able to be kind of really standardized. Their statistics, so normality was assessed kind of via histogram and the Shapiro-Wilk test. They started out with univariate logistic regression, kind of using urinary incontinence as the dependent variable, and then a lot of those selected risk factors as the independent kind of variables. And for those cases that had bilateral ectopic ureters, the most kind of severe side or value kind of was used for their data analysis. Following kind of univariate logistic regression, kind of those parameters with a p-value of less than 0.25 were carried forward for multivariate analysis. And they used stepwise logistic regression using the, I'm going to butcher this, a Kottke information criterion, which is essentially a way to figure out if the model, the best fit of the model kind of given the data that is used. And statistical significance kind of was set at p of less than or equal to 0.05. And again, these were performed kind of for both kind of short-term follow-up, i.e. 1 month, as well as long-term, kind of greater than 10 months. Oh, sorry, 10 weeks. So results, they identified 42 golden retrievers who had ectopic ureters that were laser ablated between 2016 and 2022. One was excluded, kind of again. All of their data, I presume, is not normally distributed, so everything was presented as median and range. Age median was 12 weeks, so the range of 10 to 80. Weight was 13.6 kilograms with a range of 8.7 to 35.3. And they had about 30% of their cases having bilateral ectopic ureters. Their first table depicts kind of what their urinary incontinence grades were. So not surprisingly, kind of none of the dogs were continent kind of prior to laser ablation of their ectopic ureters, with most of them kind of having moderate to severe kind of urinary incontinence. And then getting ahead of myself a little bit from order of data presentation, but since it's kind of also on this table for 1 month follow-up, it seems pretty routine that none of these patients were sent home on kind of any medications for urinary incontinence. And so without additional therapy for urinary incontinence, about 46% of them were completely continent kind of after the procedure alone at the 1 month follow-up time. And then the longer follow-up time reached 63% with the addition of other therapies kind of for their incontinence. For where their ectopic ureters kind of opened, one which is where the neck, which is the urinary bladder neck. There were 2 patients. For proximal kind of urethra, 7 patients. For mid-urethra, 17 patients. And for distal urethra or vestibule, 15 patients. I am assuming that those dogs that have bilateral ectopic ureters, they opened up in the same or similar area because they just described kind of what was seen for the 41 dogs, kind of not each individual kind of ureter themselves. For vestibulovaginal septal kind of remnants, 30 cases kind of had them present. Their proportions were out of the entire kind of cohort of 41 dogs, but 20 of them kind of had a thin membrane, 2 of them, 7 of them a moderate one, and 3 of them a thick / wide one as well. About half of their cases had historical urinary tract infections documented, and 17 of their cases had positive urine cultures that again were taken kind of at the time of the procedure. With regards to assessments for a urinary bladder neck, only 6 of them were deemed to have had no bladder neck kind of present. And for urinary bladder compliance, 10 of them were deemed to have had reduced compliance. And for their ureteral and renal pelvis measurements, they didn't necessarily say kind of how many of their dogs had dilation of their ureters kind of or renal pelvis, but overall kind of the median kind of measurement of their ectopic ureters was 3.3 millimeters with a range of 1 to 15. And for renal pelvis size, 4 millimeters with a range of 0.6 to 25. So this table kind of looks at logistic regression kind of at the 1 month follow-up time. And I guess the main things to kind of look at here kind of are kind of the odds ratios kind of in the p-values. And so from a statistical significance kind of standpoint, those things that were found to be significant kind of in their final model kind of was presence of urinary tract infections prior to laser ablation, as well as the most severely affected ureteral kind of maximal diameter. And looking at kind of the odds ratios, since an odds ratio of 1 kind of means there's no association. So 0.13 is less than that, kind of mean there's a kind of decreased odds of reaching kind of urinary continence. And then with this being kind of well above 1, there's an increased risk of reaching kind of urinary continence kind of post procedure. However, the confidence interval kind of for this value kind of was pretty broad, so hard to know exactly kind of where this number fits. Overall follow-up was a median of 92 weeks with a range from 10, again being the minimum, to 253. Medications that these patients were on kind of at long-term follow-up, 12 of them were on PPA, 1 was put on ACVNU, and then 3 patients kind of had an artificial urethral sphincter kind of placed. They also found that mortality or euthanasia occurred in kind of 4 of the patients in their study population, with 3 being determined to be due to kind of continued urinary incontinence, and 1 being problems with the artificial urethral sphincter. However, 1 of the dogs that had continued kind of incontinence, and I think UTIs as well, had a sphincter placed. For their at least 10-week or long-term follow-up, only presence of historical urinary tract infections prior to laser ablation was found to be a kind of decreased kind of risk factor for reaching urinary continence kind of in their population. So moving on to discussion, they report that achievement of urinary continence in their population of golden retrievers was pretty similar to other reports that are out there, which is pretty true. So these are some of the more kind of recent ones, kind of looking at ectopic ureters that were laser ablated. And so those that are able to report what continence kind of was without additional therapy, it was kind of on par. Though in the Hui paper, I don't think kind of all of the dogs that were kind of in this group actually had 100% continence. I think some of them, they just had kind of minor leaking. And then with additional kind of therapies for USMI, again, kind of that proportion kind of increased to about 63%, kind of, which is a little bit less kind of than what some of the other papers kind of had reported in their respective populations. Tying things kind of back to their hypotheses, urinary bladder compliance and presence of a kind of bladder neck kind of are not associated with outcome of achieving kind of urinary continence. However, overall population or sample size was relatively small, so it's possible that they were underpowered to kind of detect this association, and still technically not statistically significant, but their p-values did approach the 0.05 kind of range. Also, kind of these parameters were subjectively assessed, and kind of no definitive studies or urodynamic studies kind of were performed to truly assess for if, say, urinary bladder compliance was truly a problem kind of or not.
Will?
Yep.
So that part actually bothered me a lot. Like, I was really bummed out about this section because it really makes this aspect of the paper not repeatable. It's a completely subjective assessment that was also retrospectively scored, which I think is a little weird. But no one could take this study and repeat that because it's just it's just subjective, which there are objective ways to identify those things. So I don't think that this adds anything, and was just frustrated with this section of the paper because it ignored more effective and objective ways of measuring it. I mean, they could, even if they came up with their own scale of, we emptied the bladder and we figured out how many mils it took until the bladder was firm, and took that to patient body weight or something like that. There are ways to make it objective. Looking for the bladder neck, if the bladder's intrapelvic, well, it's really hard to, maybe impossible to see a bladder neck. If the bladder is underfilled, then it might be within the pelvic canal, but when you fill it completely, it might go into the abdomen where you have a bladder neck. So the presence of a bladder neck could partially be dependent upon location of the bladder, how full the bladder is as well too. So this made me frustrated. I didn't think it added anything, and it was so subjective and also not statistically significant. If I reviewed this paper, I would have said, get rid of all of that, because it doesn't do anything to increase our understanding of it. So yeah, I was frustrated with this aspect of the paper.
Yeah, I mean, I totally
kind of similar feelings about it, or if I'm just soapboxing as usual.
Yeah, I totally agree. Did anyone else have a kind of comment on that? I mean, again, these were their kind of main hypotheses kind of the paper. And so it was, again, disappointing to see that, again, nothing was objectively kind of assessed. Okay. Historical presence of urinary tract infections was found to be associated with a decreased chance of achieving kind of both short and long-term kind of urinary continence kind of in this kind of population. However, I think that the title of the study could be a little bit kind of misleading, kind of if you kind of read it quickly, into thinking that it is the kind of urinary tract infections themselves that are contributing kind of to the urinary incontinence. But again, kind of none of these patients had urodynamic studies. And so it is very possible, or even likely, that these patients kind of had congenital urethral sphincter kind of mechanism incompetence as the main cause for why they remained incontinent kind of following the procedure. Again, none of the dogs were kind of rescoped afterwards to kind of assess if their ureteral openings were kind of now in an appropriate kind of position. But I think that the surgeon is pretty experienced, and so probably a kind of low chance of kind of that happening. There were also kind of no assessments made kind of with regards to associations kind of with kind of any of the other kind of urogenital kind of abnormalities that were present as well too. In previous kind of studies, urinary tract infections are not found to be kind of a risk factor for continued urinary incontinence kind of post-procedure. However, a lot of those papers, I think, looked at whether or not kind of urine culture was positive kind of at the time of procedure or not, as opposed to having kind of recurrent urinary or bacterial cystitis kind of documented in the medical record. Ureteral dilation was found to be associated with short but not long-term kind of urinary continence. And I found one other study that found a similar kind of association, as well. And the authors kind of speculate that if the ureters are opening into a more normal kind of urethra without USMI, could pressures be higher, and could there be an increased chance of dilation kind of because of that? I think that the main problem kind of with that other study kind of was almost half of their kind of population were males who can get ureteral stenosis and hydroureter hydronephrosis. So it's not necessarily apples to apples. So I think kind of whether or not this is a true association for dogs that we see is kind of unknown, and potential explanation is just speculative, kind of still at this point in time. Overall, kind of things that they did well, they had a pretty homogeneous kind of population of female golden retrievers. Again, it was nice that one experienced kind of individual was performing the procedure. Again, I was under the impression that they kind of assess for presence of a urinary bladder neck and compliance kind of routinely kind of during their cystoscopic procedures. However, again, all kind of very, very subjective kind of assessment of those things. And I also kind of liked that they had a kind of standard protocol of checking up on these patients kind of 1 month post-op as well. A few of the limitations kind of involve the study design kind of being retrospective, as well as a small study cohort. And kind of because of that, there's introduction of both kind of selection bias. And so a lot of the information that was obtained for long-term follow-up for patients were probably patients that were kind of not doing well or as well as recall bias from having to interrogate the owners kind of well after their visits. Pre-op urinary tract infections were based kind of primarily on kind of urine sediment examinations. And again, there was a lot of subjectivity kind of assessment of not just some, but many of the factors, as well as kind of outcome of urinary continence kind of as well. And again, kind of one of the big limitations kind of was that no urodynamic studies kind of were performed in this group. So future direction, kind of one could consider a prospective study with better documentation of bacterial cystitis kind of in that study population, as well as performing urodynamic studies, particularly kind of urethral pressure profiles to see if congenital urethral sphincter mechanism incompetence is truly present kind of in these patients. I thought their concluding paragraph kind of was appropriately kind of stated as far as kind of what their study found from a statistical significance kind of standpoint, but not necessarily overstating kind of their findings. Again, JAPMA and AJVR kind of like fairly declarative titles. If one were to kind of read the title kind of pretty quickly, one might think again that they're associating urinary tract infections kind of with them being the main cause of why persistent urinary incontinence kind of was found. But these patients kind of likely had kind of USMI that just wasn't documented. So kind of with that, does anyone have any kind of thoughts or questions or kind of anything to contribute?
I had one thought. Thank you, Will, for the presentation. In the paper and elsewhere, it kind of is implied that response to phenylpropanolamine is a surrogate for documenting USMI, and congenital, in my opinion, congenital USMI patients less commonly respond to phenylpropanolamine than do dogs with hormonal associated incontinence. And you can look at the data for response rates for PPA overall for hormonal incontinence versus looking at all the papers that you've cited and how it's only a modest bump in improvement in continence from PPA alone. And we do quite a bit of urodynamics on especially these cream colored Goldens that are persistently incontinent, and we find a high incidence of USMI, and they just don't respond that well to PPA. So that, and then if they're severely incontinent before or after their ectopic ureters are repaired, then they're at greater risk of urinary tract infection. So, are we really, as you've said, looking at a USMI population and inferring UTI is what's important when it might be congenital incontinence?
But I would agree with you, Mary, on that. So do you think that for those young dogs, if they have a positive response to phenylpropanolamine, that would give you high suspicion of a congenital USMI, but a failure to respond doesn't exclude it? Is that how you would look at that?
Yes, I agree with that. That the failure to respond to PPA doesn't mean they don't have USMI. It just might mean that they have a form of USMI that's not going to be very responsive.
Yeah, I agree.
Larry, I just wanted to pick up on something that you said there, in that you specified particularly the light-colored golden retrievers. Yeah. And I was kind of interested in that because this study was obviously from the UK and had a lot of Goldens, and we have not as closed a gene pool as we once did, but it obviously used to be the case that you couldn't bring dogs into the UK without them spending 6 months in rabies quarantine. And so we do have a fairly sort of isolated population. That's no longer the case, and dogs can be imported, but it has meant so historically. And I just know when I came to America, I was like, the first sort of ginger colored golden retriever that I saw, I didn't know what it was because I'd never seen a golden retriever that was that color, because in England they are all relatively light. So I just thought that was kind of an interesting observation, and maybe why the prevalence is relatively high here. I don't know what other people think, but
the English, what's referred to here as the English cream golden retriever, has become very expensive, very popular, and very commonly incontinent.
So you've imported all our good stuff. That's interesting. Yeah. We don't, I mean, we do occasionally now see sort of ginger colored American Goldens, which aren't very golden, but that's a very new thing.
All right, anyone else have any other thoughts or suggestions?
All right, well, thanks, Will. That was a great review of the literature and that paper, and really appreciate you leading the discussion today. So we'll post this on our YouTube channel in case anyone who is watching wants to watch it again, so that you can check it out. Make sure you're checking the ACVNU website for the Journal Club, both in terms of the calendar and the links. And I will continue to try to send out the announcements to the ACVNU listserv so that everyone can be notified. But thanks everyone for coming. Hope you have a great day, and we'll see you all soon. I think our next one is 2 weeks. Is that right, Summer? Are we back on schedule?
Yes.
Perfect. Okay, 2 weeks. We'll see everyone then. Have a great one.
Thanks, JD.
Thanks, Will.
Thanks.